How are you, students? Today, next lecture, you see today 14, 15, 16 lecture because touch the children's and you see keywords. Today you have, we have 3 points. It is psychopathological syndromes at the children, mental retardation and mental disorders at the children. Now, first, psychopathological syndromes at the children and teenagers. You see here some syndromes. It is not all syndromes which we observe at the children. There are many syndromes, but these syndromes very often we observe in the practice of psychiatrists, maybe at the another doctors, maybe. But usually child psychiatrists in our country usually registrate these syndromes. But in the family doctors, they can registrate some symptoms, some signs, and direct to the psychiatrist. Now you see here syndromes: neuropathy, syndrome, childhood autism, hyperkinetic, pathological fantasizing, syndrome of living home and vagrancy, dysmorphophobic syndrome, overvalued hobbies and interest syndrome. Now you please pay attention, I pay attention you, it is syndromes which you must know from your self-work, but you not find I think you not find very completed and demonstrate these syndromes before lecture about mental retardation. These syndromes you must study at the self-working. Now I say very short science about every syndrome. Please remember, because I will ask you on the class, then it is a module question, because self-working topics are included in the module question and in the exam questions. Please remember, because now tendency in modern psychiatry, it is connection with primary health care, and in your country maybe too, and family doctors first should registrate, find, pay attention on these symptoms. No, first syndrome, for example, neuropathy syndrome. Usually we observe this syndrome, the symptoms, signs after birth, usually before 3 years of the age and older. No more intensive, we observe the first 3 years. Usually you see second points with somatovegetative symptoms, their prevalence. Usually mothers complains on the problems with sleep. For example, child sleep 20 minutes, then wake up, then again sleep after 1 hour, 10 minutes, then again wake up. Then problems with eating, diarrhea, maybe hidrosis, maybe crying very often, and mother does not understand what happened with him, call the doctor or address to the pediatrics what happened with child, but pediatric not find any pathology in the abdomen, for example, and neurologists don't find severe problems with health of this child. То есть maybe emotionally label very often these children. То есть prevalence, that is prevalence somatovegetative symptoms. Next, by time regressive development. But some features of behavior, of condition may remain. For example, increased nervousness, lability, they may remain in the older age. For example, child go to the school, maybe the school period, and some may be nervous, maybe stay in the adult, for example. Next syndrome, you see syndromes. There are some syndromes. For example, maybe you find due to the famous names of psychiatrists, of doctors, First name it is who open and name this syndromes as autism. It was Kanner. Then Asperger syndrome of Geller, Retta. What you can find for surnames of the famous scientists, psychiatrists, which prescribe symptoms of these disorders. No, you see, there are many points. You see, usually we observe from birth, but we cannot register on the first months, for example. We can register after 6, 9 months after birth, for example. Usually the parents' relative pay attention usually at the 2 year, 3 years, and more intensive registration or diagnostic usually the 3 years in some regions, which they, when parents relative lives very far from centers, from doctors, from medical centers, maybe registered later before school. Because many people, population, they think that it is not problem, go to the school and disappear all symptoms, but it is impossible. Next point, you see speech and development. То есть that is first words appear from 1 year, you know. For example, at 1 year, every child can say mother, father, maybe ma, fa, so on. То есть first words appear at the 1 and some months year. To the 3 years, usually it's normally. If child is normally, formation sentences, very simple sentences. For example, mother, I want to drink. Mother, I want apple, for example. Mother, buy me something, and so on. To a simple sentence, and due to the 3 years, every normally child can to communicate, ask, and so on. But it's the child autism, the speech undeveloped. At the 3 years, he knows only one, maybe word, 2 words, 3 words, and for example, which understanding only for mother, father. Then sometimes they look deaf. When we consult these children, some people address, pay attention that the children not listen, and they look deaf. And firstly, every doctor, family doctor, must direct to the specialties, for example, surdologist. The surdologist consultate and write to the doctors. It is not deaf, but problems with hearing is absent normally. The hearing is normally. Then lack of speech communications. These children not try to communicate. Every normally child try to communicate with another children. Next, lack of social functioning. These children not, for example, when maybe you have little members of the relative and so on, уже little child from 6 months, from 1 year, they can by hands say goodbye, hi, and so on. То есть they have a social, very simple social functioning. This child absence, they not say goodbye, how are you, what do you do, and so on. They not try to social function. Next very interesting point, it is present of stereotypical games, movements. Now you see, I read examples, some examples, twirling the fingers, for example, shaking them, running in the cycle in the room, for example, tapping on the objects, and so on. So there are many movements we don't understand. They not explain what they do, these children, and stereotypical games. Games very strange. For example, they usually not play in the toys. For example, boys not play with cars, little with toys, like to the cars, bus, and so on. They play usually take one pen, maybe broke pen, maybe paper, maybe different objects without game interest, for example. Так, it is stereotypical games. Next, prognosis is not good because formation mental disability, and it's very difficult to look at these children because they are very harmonic, they are nice, beautiful, the face is very beautiful, but they cannot talking with us, and we write it is our conclusion, it is child autism, and you see last points usually accompanied by bad intelligence, and usually companies decrease intelligence IQ, and intelligence not develop as normally, and usually this child can care, and maybe some relative in the city can find medical centers when this child is go to the and get education, but it is not normal education, it is special education. Hyperkinetic syndrome, manifestation at the age usually between 1.5 and 17 years, we usually observe, but especially as the children, more intensive manifestation, we observe at the children preschool and primary school age. It is between 6 and, for example, 10, 11 years. No, you see these children, maybe these people very often around you. It is excessive activity, very increased impulsiveness, a dash of unnecessary movements, different, for example. They often constantly dropping something, touching, maybe fall down on the, то есть many they have movements problems. Then accompanied by deficit attention, and because as a result of it is hyperkinetic behavior and deficit attention, they have problems in the school, in the education. But they have normal intelligence, but from deficit attention and behavior, they suffering and maybe has academically problems. Next, pathological fantasizing syndrome usually start from 2-3 years. It is depends from development of mind this child, usually from 2-3 years. In these years, usually formation brain, the cover of the brain formatted, and formation develops the imagination. And from 3 years in normally, if you know, there are many children, all children in the normal start to ask their parents about different questions. They can comparison, they analyze, they synthesis at the 3 years due to this age. For example, ask why, for example, a plane in the sky, why bird they are flying, why, how, and so on. So there are many questions from the 3 years we get from little children. In the pathological fantasizing games, for example, pathological games, maybe when child transformation transformate in the characters of animals, different objects become, if, for example, plane become as Batman, become as another bird, for example, and so on. But it is not transformation for normal children. It games, you see, next point, repetitive character every day, for example, repeated, and duration. You see next point, duration. Can play it for hours every day, one game, for example. It's very difficult for parents, for relative, because they ask the child, go to the street and let's go to the look something, go to the eat, and so on. But it is very sustainability condition, and they, when around people ask them come to me and so on, they have irritation, they irritate, maybe crying and so on, angry, aggressive, and so on. It is about transformation for long time, for long time. It is for usually preschool children, transformation to the different objects. It is one kind of the pathological fantasizing. In the more older children, for example, after уже primary school period, after 7, for example, year, they have forms of representations or images. In this, they can see it and think about, look, internal place, and by images. Sometimes they can draw these images in the paper. Sometimes before sleep, they have this many images before sleep, maybe image some hours, 2 hours, and so on before sleep, talking about these images long time in the day, and so on. It is formate deficit attention in the class, maybe problems in the school education. And adolescence period, maybe incrimination and self-incriminations. It's very interesting phenomenon. Incrimination, for example, they incriminate the relative in the some very bad situations, in bad actions. For example, one teenager said his father is crimer, mother too is crimer, father sit in the, for example, prison, but really it is not true. The father, normal man, go to the job, maybe driver, maybe other profession, mother is maybe normally too, maybe teacher, maybe sailor, and so on. And self-incrimination. Self-incrimination, when this teenager incriminate herself or himself in the crimes, maybe. For example, one teenager said he helped two policemen to find one crimer. He's maybe crimer too, and so on. So it is self-incriminations. Maybe different, no, many cases about this. Usually we observe incrimination, we observe at the teenager who has not good hereditary. Usually at the members we observe patients with schizophrenia. Self-incrimination, maybe it is fantasy identical due to the schizophrenia or schizoid disorder, or maybe it's children with psychological defenses during bad upbringing, during formation, maybe personality disorders, formation during as compensatory reaction. Next, syndrome of living home and vagrancy. Age between, usually we observe 17 years. Usually we observe very often in our countries it is reactive living home due to the stressful situations. No, for example, child get in the school bad estimations, father, mother influence. Why? you have a very bad education, we have job, we go to the job, salary, we lose time for you, eat you, dress you, and so on. Maybe beat this child, and after that the child go away from home because stressful situations at the home. Maybe parents very not good adult, for example, alcohol intoxication, may be aggressive in the not very good situation in the family, and child go away from home and walking in the street, not back at home. Duration may be days, weeks. Usually they go away from home in the warm times, seasons of the year, for example, in the summer, spring, autumn. In the winter, it's very seldom, but maybe. Next, curiosity, striving for new. Next factor why they live in home and vagrancy, it is curiosity. They have motivation, and next motivation, it is striving for new experience. Strike or striving for new experience. Find different and new situation, go to the new park, for example, due to the supermarket, walking among toys, for example, in the supermarket, go to in the summer different parks, maybe sit in the bus or train and sit and travel in one side to another side, and so on. Over time, maybe appear negative consequences, for example, formation of social behavior, deceit, theft, delinquency. If it is repeat, especially when reactive living due to the stressful situation, it is repetition has negative consequences because child has routine behavior, a social routine behavior formation, go to the stores, maybe steal something, bread and so on, sleep in the different place, find another identical friends, they together provide times and so on. This formation bad delinquency. Then more teenage period, after teenage period, maybe smoking and formation specific personality disorder. Remember previous lecture. Dysmorphophobia syndrome in adolescence, in teenagers, usually we observe, not in the previous age. It is pathological idea of physical disabilities or physical shortcomings, maybe. Usually we observe mirror symptom and symptom, not pictures, photo symptom, mirror symptoms and photo symptoms. It is when they again and again during them look in the mirror, for example, and find these defects of the body, for example, very long nose or maybe little eyes, for example, look every day from morning to the night, and take photo to the specialist and demonstrate what the shortcomings they have. For example, they ask to parents address to the surgeon or cosmetologist, polyclinic, go to there and ask about changes this body, this nose, this lips, this eyes, and so on. And by time it is accompanied by depressive mood, because appear depression because they have shortcomings and they suffering, and decrease social activity. because it is very intensive for this teenager. He lose interest, he lose education, he lose friends, and so on, maybe negative consequences. You see in the title anorexia nervosa, yes, it is 50-59, but if arise in the teenager, for example, 12 years, 13 years, we can talking about dysmorphophobia syndrome. If it is syndrome continue, if person consider, teenager consider he has very large, big weight, we transfer and write anorexia nervosa. Next, last syndrome, overvalued hobbies and interest syndrome, usually observed in the teenage period, more often in the teenager with schizoid radical, who has these traits as to be alone, introversia, for example, isolation, what usually they suffering with this syndrome, usually characterized by hobbies, strange hobbies. For example, you see collecting bird feces, for example, bus tickets, drawing up diagrams, drawings, but these interests and these hobbies, they have not productive, they are unproductive, to is not bring to the person improving knowledges, for example, in you more higher interest and so on, not develop. Так, we finish syndromes. I hope you will remember and continue. Today topic next, mental retardation. Main features of the chapter. You see etiology. No, usually this chapter very simple, is characterized only one disease, one disorder. It is mental retardation. On the previous chapters, you see F60, for example, there are many topics. You saw here only mental retardation. You should say and know about etiology. It is ante, peri, and postnatal factors. Please remember natal factors. It is factors which we observe during pregnancy, before delivery, before labor. It is antenatal. Perinatal, please remember from pediatric, maybe you know, it is 10 days after labor, after birth. For example, child born, from birth to the 10 days, it is perinatal factors, and postnatal factors after perinatal to the 3 years. If you remember, at the 3 years, brain formatted is top. It is connected with formation of the brain. Так, next, retarded mental development, main sign of this disorder, retarded mental development. Stable conditions during whole life, stable conditions. То есть if a child born with mental retardation, all life he or she will with this mental retardation, not recovering. Different level of disturbances, there are 4 levels, and rehabilitation depends from level of disturbances. No, you see, for example, you can answer it is Down syndrome, yes. То есть, firstly, without medical education, everybody from population can say, because they have identical physical traits, identical head, neck, eyes, nose usually, and so on. Very short, for example, head, arms, legs, and large tongue, and so on. So due to the only physical traits, we can understand they are Down syndrome. But in some cases, very difficult to establish mild mental retardation. Please hear definition. Definition is a condition of arrested or incomplete development of the mind, which is especially characterized by impairment of skills manifested during the developmental period, which contribute to the overall level of intelligence, cognitive, language, motor, and social abilities. No, it's very, very long definition due to the ICD-10. You can understand more short definition, for example, other definitions. What very short definition when mental retardation is condition of retarded development. Next definition, more understanding, is group of pathological conditions arising from different factors and having a main sign, it is undeveloped the psyche. Etiology. Prenatal, I repeat, prenatal factors. It is different diseases mother during pregnancy. Very bad influence their disease. And toxoplasmosis, listeriosis, Lewis, rubella, other infection, maybe severe infections, especially in the during pregnancy, for example, which during infections when mother take different medicines, maybe during pregnancy, usually the gynecologist recommended to every woman exclude any drugs, any medicines, because they can influence on the embryon. Then perinatal, you remember, during first after labor, during first days, usually these problems connected with labor. During labor, maybe problems, for example, asphyxia, natal trauma maybe, and disease of burn during these days. For example, during often these factors, rhesus conflict maybe any bone disease in sepsis maybe in these days, maybe bad care and child in the 2-3 days has pneumonia and so on, maybe different diseases during these 10 days. Postnatal factors, trauma, infections, somatic diseases before 3 years. No, usually often we observe in the children this anemia, for example, infection disease, meningitis, neuroinfection. Usually meningitis has bad influence on the formation intelligence. Usually after meningitis before 3 years, we get child with retardation. Trauma, they fell down from bed from different places, for example, from arms of the father, mother, and so on, from all the brothers, sisters, and somatic disease. Retardation can occur with or without any other mental or physical disorders. No, for example, you see before Down syndrome, it is physical, different problems has child, heart problems, eyes problems, they have bad visual bad, and for example, retardation, or maybe child paralysis disorder disease. They cannot walking and so on, cannot do anything with arms. They have paralysis in the arms, in the legs, accompanied by mental retardation, can accompanies. Next, mentally retarded individuals can experience the full range of mental disorders. No, they can have psychotic symptoms, for example, they identical as normally person can have stress, for example. They may be object of different physical, you see next point, they can be objects of the exploitation and physical sexual abuse. They can have psychotic symptoms, they have behavioral disorders, they can have fears, maybe dark fears and so on. So it's different, all full range of mental disorders. For example, I remember a no, girl, for example, she was 17 years. She had depression because she stayed alone in Bishkek. All the sister was married and went leave the Kyrgyzstan, went away from another city. Mother, father absent, and so on. And she had depression, for example, but she had mild um, mental retardation. Adaptive behavior is always impaired, but in protected social environments where support is available, this impairment may not be at all obvious in subject with mild mental retardation. То есть when person has mild mental retardation, mild, and with support of relative, maybe and other people, she can continue and social adaptation may be well. We know in our countries some people with mental retardation, with mild father, mother, they have mild mental retardation, they have good adaptation because they are farmers, they have a simple job, only garden, and so on. Diagnostic mental retardation. Present intellectual functioning resulting is in diminished ability to adapt to the daily demands of the normal social environment. Then associated mental or physical disorders have a mere influence on the clinical picture and use made of any skills. The global assessment of ability and not on any single area of specific impairment of skill, and the IQ levels given are provided as guide and should not be applied rigidly in view of the problems of cross-cultural validity. Due to the ICD-10, the classification of every level depends from IQ. But you see in this point, in the different countries, there are different cross-cultural validity, and every country use these different psychological tests and IQ count, no, maybe difference. And we use, for example, Wechsler test, Ravenna test, and count the IQ, and try use this criteria. But in some cases, IQ not it is main criteria. On the first, you remember it is main criteria. It is clinical criteria. We see. Pay attention on the adaptation, what the clinical science, what the behavior, what the communication of this person with around people and so on. Then take account the IQ and only after that write it is mild or moderate mental retardation. That is, you must understand that IQ it is not main criteria, but in the ICD-10, I repeat, it is criteria when we observe four levels of mental retardation. Categories given below are arbitrary divisions of a complex continuum and cannot be defined with absolute precision. IQ must be determined from standard intelligence tests based on the local cultural norms. So it's maybe in your country another, maybe you don't use IQ, I don't know. Test must match the level of human functioning. Classification. Due to the many tests, for example, Wechsler test, we have 4 levels, you see. Mild, it is 70 to the 50. Next, moderate, severe, and profound. Profound, you see, maybe only like to the burn child, for example, person 10 years, 20 years, but his mental skills at the level of 0, like to the infant, to the born child. So it's not care, only lying in the bed, cannot eat himself, and so on. It is very, very bad, and in every country there are these people we have, and they are in the special internats. In the normal IQ must be 100. Maybe you know, 100 it is standard. A lot of people has one, no, nearest 100 ball. It is ball. No, some people has 90, some 95. If IQ more 120, 30, especially 40, it is very high intelligence. You must remember, normal standard, it is 100 plus minus 10 bell. From 90 to the 110, it is normal variations. And remember, if IQ more 70, for example, 70 to 75 to the 80, usually it is next topic today. I will read next topic. It is disturbances of psychological development. It is next topic. It is condition between normal and between mental retardation. We have third positions. Так, next, mild mental retardation. Speech is developmentally delayed, but most of them achieve the ability to use speech for everyday purpose in an interview. No, speech, for example, remember, usually speech arises at the 1 year first, then to the 2-3 years, usually every child has speech, very simple sentences. In this case, usually develop is retarded, and usually first sentence can appear after 3 years, 4 years, 5 years in some cases. And usually in the adult period, they can to communicate. For example, if I ask, what's your name, what do you do at home, and so on, this person can answer. To a simple interview, this person support. Most of them also achieve complete independence in self-care. So with mild mental retardation, the most person can live alone. For example, they formate household skills formation. For example, they can prepare cooking and so on. For example, some of them, especially men, do different furnitures, for example, and so on. Then main difficulties are usually seen in academic school. Usually with mild mental retardation, they cannot learn in the state school, for example, in every country. In our country, for these children, in many countries, for these children, usually state formate special schools. In our Bishkek, there are free schools for mental retarded children. In some regions, for example, where the population a little number, there is maybe classes for these children. And now modern time, maybe you listen about inclusive education, when with mild mental retardation, the child go to the usual state school, go to the and sit in the primary school with all children, with normal intelligence children. And the society try provide inclusive education. Так, most of this person with mild, they can learn and take practical different skills, and then continue live alone, and usually conduct unskilled or semi-skilled manual labor. No, for example, previous I said about that man can, for example, do with furniture, simple, for example, make different actions and create furnitures, help to other specialties, and have job in the different plan. Maybe unskilled, for example, clean the street in the morning and so on. It is unskilled and semi-skilled manual labor. And in social cultural context, these people can live, can create a family, can burn children. Mild have usually diagnostic criteria IQ. Develop of speech is enough to communicate. Education usually better in special schools because they have special programs and programs for formation work skills. Can be married, can have children, can live independent, can work unskilled or semi-skilled manual labor. Moderate mental disorders, IQ, UC, development of speech is enough to communicate with people, but very, very simple speech. For example, a person maybe 15 years, speech is very, very simple. The learning is impossible on the special program. They can go to the special program, but they only maybe first year learn, then impossible. Independent living is impossible, то есть they need in the care. They need it in care, mistake, from relatives, not from relative. They can make unskilled labor under observations. For example, it usually they can work in the home, clean the garden, clean the house, for example, wash the plate. Self-supervised skills develops later. It is go to the toilet, for example, to the bus. Severe mental retardation, IQ, you see, the speech absent or limited by several simple words. Self-supervised skills develop very slowly and not enough for social activity. They need in the constant observation, day, night, because relative cannot stay this person alone at the home, maybe problems, fire, maybe open the door and the person go away and so on. Parents can have rights to refuse from this child. The child is, in this case, is directed in special boarding for psychochronic patients. If parents continue to care this person, they have rights to get pension, state pension. In our country, it's very, very little pension, some thousands of the sum. It is not enough, but a little help from state. Так, severe mental retardation. It is very difficult to care 24 hours for this person. Usually the parents, if they can, they pay and ask the another people, for example, find another people, woman or men, and pay for the work, for care this child or adult. Profound mental retardation, very severe, profound, very difficult kinds. Speech absent, communication only, maybe only by psychomotor level, mimics reaction, move reaction. For example, by gestures, they do move by head and personal stuff understand. This child cannot to it, or maybe want to eat, and so on. They need in constant observation all 24 hours. Self-survival skills are absent and don't develop. Very difficult to care for these people. As rule, they are in the boarding child. No, at the home stays this child very difficult because parents busy on the job. There are maybe another children in the home, and usually they refuse from this child in the afterborn, and this child upbringing in the boarding child organization. Так, it is a lot of mental retarded person has mild mental retardation. If we take all four levels for 100%, all mild, moderate, severe, profound, for example, 100%, among them level, mild mental retardation has 80-90%. General science. General science, additional information for mental retarded person. It is inability to logic thinking, prevalence concrete thinking, absence critical attitude to self and to circumstances, predominance biological needs. They want to eat, for example, predominance. They have not intellectual, for example, needs. It is pathological condition without progressive development. Так, rehabilitation. Rehabilitation, usually it is psychological support, stimulation, pedagogic education, stimulation, different centers, gardens, schools, social support, care, pensions, for example, from state, symptomatic treatment. You see by red sentences, the specific treatment is absent. So these problems with mental retardation will stay. This problem was present and stay in the future. The specific treatment is absent. If treatment was present, the problem will be absent. A symptomatic treatment, for example, how do you understand? Mental retardation may, if you remember, accompanies different mental disorders, maybe depression, maybe seizures, maybe syncope, maybe fears, maybe what else? Another different, maybe psychotic symptoms one time after stress, for example. In these cases, we prescribe symptomatic treatment. Psychotropic drugs, you know. But on the first place, rehabilitation, the psychological, pedagogic rehabilitation. If it is child, it is very important, psychological and pedagogic. If she adult, for example, 20 years, 30 years, in some cases we see, for example, adult 17 years because he only go to the commission which decide he go to the army or don't. And in the 18 years, we only firstly write diagnosis mild mental retardation. Maybe this situation in your country may be identical. What in these cases, social support, you see, not only pension, the relative should find maybe job, simple job, to clean the streets, maybe to help to the something, go to the plant to create furniture, to help to build furniture, for example. So it's usually it must be social support. Так, next topic, due to the ICD-10, it is 8089. Disorders of psychological development. Features. Onset is during infancy or childhood. Delay in the development is related to biological maturation of the CNS, central nervous system, including language, visual, spatial skills, motor coordination, and so on. The impairments decrease as children grow older. The genetic factors can play an important role in the etiology of many, but not all cases. Environmental factors often can influence too. We can diagnostic, for example, from childhood, from infancy period. Structure. This chapter includes next point, for example, specific development disorders of the speech, then second group large, the specific development disorders of the scholastic skills, for example, specific reading disorder, spelling disorder, and arithmetical skills, it is dyscalculia, and pervasive developmental disorders. Specific speech articulation from speech disorders, for example, speech articulation disorder, or another title, dyslalia. Dyslalia, please remember. Articulation skills are not age appropriate. For example, some sounds of some letter, the child cannot pronounce it at the 7th year. At the 7th year in our country, before school, in your country maybe school, it may be European country, start from, they name schools, child garden from 3 years school. In our understanding, we have child garden before 7 years, from 7 years it is school period. So please differ these different cultural features. In your country, I don't know. In our country, repeat, school start from 7 years. For example, we consider before school year, before 7th year, every child should know all sounds of alphabet. For example, Kyrgyz school, child must know all sounds, letters of alphabet, Kyrgyz language. Go to the Russian school, must know all sounds of alphabet Russian. English school, for example, in our country, maybe English school, one school, all sounds of letters. If child cannot pronounce the sounds, cannot talk, for example, R, S, and so on, different sounds of the letter, it is named dyslalia. Usually you see 2 standard deviations delay. For example, his speech skills, his 7 year, are speech skills according to the 5 year, for example. Absence of neurological sensory disorders affecting the sound production of speech. We must exclude neurological disorders, sensory disorders, which explain, for example, dyslalia. То есть neurologists and other specialists, for example, consultate and write articulation apparatus, tongue, throat, and so on is normally. And then exclusion criteria, we must exclude mental retardation. That is dyslalia not connected with mental retardation. Next, in this chapter, it was speech disorders. Now, scholastic skills, in short, learning disorders. Learning disorders or specific developmental disorders of scholastic skills. Very, very long terminology. These are disorders in which the normal patterns of skills acquisition are disturbed from the early stage of development. No, for example, you see, for example, on this table, learning disorders or scholastic skills disturbances. We must exclude, you see, by white letters, sentences, absence of vision problems and under normal learning conditions at school. То есть we must exclude problems with visions. The vision is normally, то есть ophthalmologists consultate and write the sight is normally. And we must exclude problems in the school. То есть school is normally, has very good school conditions, very normally clean, light, windows, the different tables, there are maybe 20, 30 people in the class and so on, normally conditions. And when we exclude these problems, we find the child, for example, dyslexia. Dyslexia, it is impaired reading skills. Misreading, not recognizing words, for example, it is main, I write in short because you not pediatrics, and very, very short diagnostic science. Impaired reading skills, misreadings, not recognizing words. No, for example, when we ask on the consultation, we give the boy, girl text, for example, short text, and ask, please to read. Then boy, for example, boy read, and we find he not read very good according to the age, for example, 8, but he very slowly lose the place of reading, not recognizing the words, disturb the words. We understand it is this boy has dyslexia. Dysgraphia impaired development of writing skills. For example, we observe, ask the relative to bring the school's paper when written by boy, different exercises, home exercises, or maybe, for example, if parents forgot, we ask the boy or girl to write, give them paper and pencil, and ask, please draw the man, draw the house, and write your name, where you, and so on. And we see how writes this child. Normally, maybe disturb the not count the lines when she write. Maybe very disturbed of the words. Maybe lose some letters. and so on. Maybe one letter very big, another letter very little, and so on. То есть we understand it is dysgraphia. То есть suffering with dysgraphia, and at school this child get bad estimation, bad marks. And dyscalculia, for example, impaired development of arithmetic skills, dyscalculia, when child has problems with counts. For example, very simple counts, maybe child 7, 8 years cannot, for example, decide 5 plus 6, for example. No, maybe with mild can decide, for example, with moderate cannot. It is dyscalculia. We ask the child, for example, 7-year count the fingers on the arm. He can count. With mental retardation, cannot count. With this child with developmental disorders can count, but cannot count more difficult exercises. For example, with one unknown figure, for example, x plus 25, then we get 223, for example. То есть cannot decide some examples. We understand this child has problem with count skills, but it is not mental retardation. We must exclude mental retardation. Mental retarded person has more severe problems. They have identical dyslexia, dysgraphia, dyscalculia, can have all these 3 types, but in more severe form. In this case, the child can have maybe only dyslexia and dysgraphia, but not problems with calculation. Maybe opposite situation. For example, a child has problems with mathematics, cannot very good count, but without problems dyslexia and dysgraphia. In these cases, we say about child who has humanitarian tendency, and maybe in the future check profession connected with humanistic professions, for example, philologist, journalist, and so on. Mathematics who has problem with writing, with reading, but have very good calculation, maybe take profession with when use these mathematical skills. Next, pervasive developmental disorders. When I was talking about syndrome autism, I said about this. Pervasive development disorder defined by the presence of abnormal development. Remember, it is in this case you must talking about syndrome autism, manifest before age of 3 years. It is abnormal functioning in the areas of social interaction, communication, restricted, repetitive behavior. Remember, you can say, you can answer here about autism syndrome. Now you see, for example, pictures on the from left side, you see normal child. On the right side, you see child with autism. Normal child, please, expression of the face, you see the eyes, the look very normally, with interest, with mimics, yes, for example, above picture, a little smile maybe, she understanding what maybe see very joke, maybe see mother or so on. There is very satisfaction, and you see the look of the eyes has interest, manifestation of the interests. And second picture, you see one child love another child. It is demonstration empathy, yes, to another. It is communications, it is interest to another children. You see the little child with very good satisfaction. She listens the music, maybe voices of the different animals, maybe music, and very demonstrate satisfaction. And on the right side, you see a child with autism. For example, when we talking with, you see the pictures, they not, the eyes, look of the eyes not demonstrate any interest to communication. They have not interest to communicate with other children. Sometimes they maybe listen some different noises, maybe hallucination, but we cannot understand it is hallucination or no, because they not talking with us. The number of the words is minimum, and they not use speech for communications. It is what you see due to the amimic, and sometimes they not support visual contact. Visual contact in normally usually some seconds. Usually we pay attention on the face, yes, some seconds, then we turn our heads. Then again, visual contact. These children not support visual contact. They look in another object, another window, another table, and so on, not support visual contact. If we ask them, look at me, they look, but look across our body. We not see the interest in the look of these children. Так, and next lecture, 99, next lecture, it is emotional disorders with onset specific to childhood, emotional and behavioral disorders. Structure. I forgot to write behavioral. Structure here, behavioral disorders, you see hyperkinetic disorders, conduct disorders, mixed disorders of conduct and emotions, and emotional disorders with onset specific to the childhood. Hyperkinetic disorders, group disorders characterized. Now you see, early onset, usually first 5 years of the life, hyperkinetic, but on the syndrome, you remember, here I write more extensive manifestations of the syndrome, but start came from 1-2 years. Lack of persistent inactivities that require cognitive involvement, tendency to move from one activity to another without complaining to anyone, together with disorganized, ill-regulated, and excessive activity. This group of disorders very often accompanies with deficit of attention and, for example, main signs. Recklessness, impulsivity, you remember hyperkinetic syndrome, it is identical. If we, for example, syndrome, when we, for example, family doctors diagnose, he can write syndrome hyperkinetic and direct it to the psychiatrist, and psychiatrist, due to the symptoms, write hyperactive disorder. Impulsivity, accidents prone very often, unconscious violations of the rules, and as a result, disciplinary problems. Very often the parents invited to the school, for example. A relationship with adults are broken due to the lack of restraint, unpopular with other children, and maybe isolated. No, because their impulsivity maybe disturbs the game of another children, and another children not continue to support friendship with this child. Maybe this Cognitive impairment, maybe specific delays in motor and language development. Secondary complications include dissocial behavior and low self-esteem. No, by time it is secondary complications. Maybe problems if because it is repeated and nobody not understands the children. For example, parents only beat this child and so on, does not understand his behavior because this child born with this activity. Parents consider it is not good child, for example, and every time beat, use verbal aggression, physical aggressive influence, and so on, maybe bad complications, maybe bad, and then formation, maybe personality disorder. Different, maybe different ways. Conduct disorder. Conduct disorders characterized by repeated or persistent incidents of dissocial, aggressive, or deviant behavior. As a result, social disadaptation. The duration must be minimum 6 months or more. If this disorder is more, 6 months, 1 year, 2 years, we can write conduct disorder. And conduct disorder should be primary. You must understand, for example, if we have, for example, symptoms of schizophrenia, and then disorders of behavior, for example, after influence of the hallucination or delusion, the teenager change different non-adequate actions, maybe fire something and so on. It is behavioral disorders. It is secondary. It is not conduct disorders. We write schizophrenia and understand schizophrenia has many symptoms and behavioral too. If we exclude all previous disorders, include schizophrenia, so on, severe disorders of head trauma, so on, we can write conduct disorders, primary. No, for example, the person child has bad childhood, bad upbringing, then teenage period, continue bad upbringing, the child leaving home, driving, walking in the street, meets the bad company, then reaction of group, continue to live with group, like the interest, start to smoke, to take alcohol, so on, and gradually formation personality disorder. То есть it is primary conduct disorders, primary. Usually influence psychogenic factors. It is chronic, persistent problems, psychological problems of this child. Then formation these conduct disorders must be primary, exclude another disorders. When parents, for example, no, maybe not parents only guilt, maybe another problems, for example, when formation these conduct disorders, and then parents or relative address for consultation, we must exclude another different disorders. Exclude head trauma, epilepsy, exclude chapter F20, exclude schizophrenia, acute transient psychotic disorder, exclude depressive episodes, for example. Exclude many disorders and other mental disorders. Only after that we can write conduct disorders due to this clinical picture. No, conduct disorders, what may be examples of behavior? There are different maybe examples, for example, excessive levels of fighting or bullying maybe. I demonstrated different pictures on the class. Remember fighting or bullying maybe when, for example, teenager bullying the little children in the school, maybe racket, for example, in the school. Cruelty to other people or animals. We observe this situation, actions. Severe destructiveness to property. For example, they by group, go walking in the street and maybe make different bad, disturb the car of the people, for example. Fire setting maybe, stealing, but it is not stealing as pathology of desire. It is stealing for get money, or maybe stealing of food, for example, because they are hungry. Stealing for take money to buy something, maybe some smoke, alcohol, and so on. Repeated lying, then truancy from school and running away from home, maybe formation syndrome of leaving the home, unusually frequent and severe temper tantrums, disobedience, and so on. So there are many manifestations of, in some cases, maybe more severe actions, and they, policemen, maybe take on the count, maybe crimes, maybe kill the people. Next, conduct disorder confined to the family context. Maybe some conduct disorders involving dissocial or aggressive behavior, in which the abnormal behavior is entirely or almost entirely confined to the home and to interaction with the members of nuclear family. So this conduct disorder we observe only in the family. Outside, we don't register, the family don't register these problems, for example, only in the family. For example, was one on the consultation family when a child steal money only from family, from father, mother, and so on. Outside, he does not steal anything from shop on any situations, and so only in the family. То есть maybe this problems with behavior only in the family, maybe aggressive behavior in the only internal. Так, back to the conduct disorder, unsocialized and maybe socialized conduct disorder. Please remember, unsocialized disorder characterized by a combination persistent dissocial or aggressive behavior, and conduct disorder solitary aggressive type, unsocial the aggressive disorder. То есть unsocialized conduct disorder when a teenager, for example, make different actions alone, without any groups, without another teenagers. Socialized conduct disorder, this combination persistent dissocial or aggressive behavior by group type of disorder, conduct disorder or group type, group delinquency, maybe another terminology, offenses in the context of gang membership, stealing in company with others, for example, truancy from school, and so on. То есть you remember only socialized when teenager make different actions with groups, in the groups, with other children, with other teenagers. Unsocialized when alone. The manifestation may be identical, Next, sibling rivalry disorder or sibling jealousy disorder. Some degree of emotional disturbances usually follow the birth of immediately younger sibling, shown by majority children. Sibling jealousy disorder should be diagnosed only if the degree of persistence of the disturbances is both statistically unusual and associated with abnormalities of social interaction. There are many cases, but only seldom with these problems addressed to psychiatrists. Usually family, the parents they themselves decide this problem, but sometimes address for consultation. During consultation, we can say only it is not treatment for these problems, and we usually consultate and teach the parents how to relate with children's, not demonstrate very severe loving to little child, because more older children, they start to think the love finish from parents to them. They feel they are alone. Now the parents love only younger child, and formation negative feelings from this child to the attitude to the younger children, to the younger sibling. Maybe different consequences, maybe bad consequences, because I remember one case in our Bishkek when termination was very bad. The older child, boy, 11, 12 years, it is not was due to the father, this was a younger brother, but mother was another. The husband left the family and marriage again, and had a newborn. And this older son visits the younger, was very loving, but he was listening the voices of the new wife of the father. Why your son visit us, infection maybe, and so on, bad voices. And after that, he killed this little boy. No, maybe different situation, but it is very, very rare situation, but usually arise conflicts. And usually older child has negative feelings in attitude to the younger child, and maybe conflicts. In order to exclude this formation of negative feelings, every parent must prepare older child to the born little child, then not demonstrate very love to the younger child, must be identical demonstration of loving, support older, sometimes to talk about older child, I love you, and so on. Because it is a formation, good formation of emotional condition. Next, elective mutism. The condition is characterized by a marked emotionally determined selectivity in speaking, such that the child demonstrates his or her language competence in some situation, but fails to speak in another. For example, we can observe this situation in the family and school. In the family, this child talking very good, talking with father, mother, and other children's friends, and so on. But when this child go to the school, keep silence, not answer. And usually this disorder first manifests in early childhood, maybe when go to the child garden, maybe 4, 5 years, and maybe primary school age, first, second class. Then gradually disappear, maybe. But I know one case, maybe to the teenage period was keep silence in the school, in the orally answer, but this child make all written exercises, but refuse from oral answers. It is elective mutism, то есть articulation apparatus in normally, absence in other problems, but demonstrate this elective mutism. Connected with personal qualities of this child, usually connected with on this previous chapter, it is non-good development of speech, problem with speech, maybe later formation of the speech, and anxious, high level of anxiety. Due to these reasons, we usually see this disorder, elective mutism. Next, non-organic enuresis. Non-organic enuresis, it is involuntary urination during the day and or night, does not correspond to the mental age of the person. No, for example, 10 years, yes, it is abnormal, yes, abnormal if child 10 years and urination at the night. Is not the result of lack of bladder control. We exclude neurological disorders, epilepsy, seizures, abnormalities of urinary tract, and so on. Exclude all organic somatic pathology. Enuresis may have been present from birth, then may occur after period of acquired bladder control. Understand, for example, childbirth, and no, every infant, yes, urination, yes, but due to the world organizations, normally, when child can urination to the 3 years at the girl, for the 4 years at the boy. But in these cases, non-organic enuresis, this boy continue have urination to the 10 years, 12 years, 14 years. Так, then may occur after period of here, то есть, for example, child born after 1-2 years arise period of control urination, mother very glad, at the night the child not have any urination, but after one stress, at the 7th year, for example, after severe stress, the boy start have this urination, involuntary urination at the night. Maybe this, it is secondary. Secondary enuresis. In first example, it is primary enuresis. Next, emotional problems may arise, because this boy, girl have distress or stigma, because they cannot go to the summer camp, for example, go to the travel with another children, only with family, can't travel during some days, week, because it's very accompanies with problems. Then enuresis may form part of some other psychiatric disease. In this case, we must exclude. When we see the enuresis part of some other psychiatric disorder, for example, epilepsy and so on, we must exclude. Non-organic encopresis, repetitive voluntary or involuntary discharge of feces, usually of normal or almost normal consistency, in places that are not suitable for this purpose in the social, cultural environment of a person. Deliberate deposition of feces in inappropriate places despite normal physiological bowel control. And the condition may run as monosymptomatic disorder or may be part of broader disorder, especially an emotional conduct disorder. Значит, here you must understand the non-organic encopresis. You must exclude identical enuresis. You must exclude all neurological, surgical, somatic disorders. The parents must go to the pediatrics, to the surgeries, proctologist, neurologist, and exclude any local, maybe local defects, maybe not local defects from brain problems in this place. After that, when psychiatrists get results, dates of the examination, and understand the health is normal, somatic, neurological is healthy, he can write non-organic encopresis, but psychiatrists can exclude another disorders, schizophrenic, maybe non-organic encopresis as a reaction of refusing, for example, little children. For example, 5-year child not go to the toilet, go to the table in the kitchen and demonstrate this. It is maybe during reaction, maybe neurotic reaction, maybe a stressful reaction, and so on. То есть exclude another problems, mental disorders in these children, and find emotional and emotional problems, psychological problems of this child. Usually problems, it is very often we observe at the boy, it is problem of connection with mother, between mother, and due to the trait, it is very dependence between mother and boy. And usually because non-organic encopresis, I forgot to say, it is all disorders we observe at the children with normal intelligence. For mother, it's very, very strange behavior because the son go to school, get very good estimation, 4 and 5, but sometimes she feels olfactory, she feels the bad smells from sun. And she does not understand what is it. First time she does not understand, and maybe influence, verbally aggressive influence on the boy. After that, the continue this problem, she take child, go to the different doctors. And when neurologists direct to the psychiatrist, this mother don't understand why. It is maybe physical problem. Why psychiatrist must consultate? Yes, maybe negative attitude. Only after that, psychiatrist write it is non-organic encopresis and decide problem. They consultate child, find the problem, then consultate mother. And during consultation, explain to the mother what the emotional problems has this child. And after that, usually disappear problems. Stereotype movement disorders, maybe it is repetitive stereotypical rhythmic movements, not without any neurological problems. You see please here listed body wiggle, head wiggle, hair, plucking hair, and so on. Stereotypical self-harming maybe behaviors, what you see, head banging about wall, maybe poking eyes, beating hands, and so on. So there are many stereotype movements disorders. And if stereotypical movements arise in connection with mental retardation, then the diagnosis of mental retardation. We observe usually the stereotype movements disorders, very often there may be children with schizophrenia and mental retardation. If we see the intelligence is abnormal, we write it is mental retardation, and secondary write stereotype movements disorder. Can write, cannot write, but we see, usually we observe as a mental retarded children. No, because in this topic, these movements disorders, because you see the title, it is emotional and behavioral disorders. Behavioral disorders connected with volitional spheres. Volitional spheres includes behavioral disorders and movements disorders, yes? And because we, in the ICD-10, this topic is situated in this F1999. Tic disorders is involuntary, repeat, recurrent, non-rhythmic motor movements. You usually very often can observe it the people in the population, and the not only children and the adult. maybe when very often close the eyes, maybe these tic disorders, maybe tic disorders by nose, by lips, usually touch the face. But maybe in the arms, in the fingers, maybe vocal tic disorders, for example, during speech, person repeat and repeat after one word, repeat one word, for example, memes. Maybe you very often answer ma'am, ma'am, after every word you say ma'am. This may be answer to the vocal tics. No, it is not vocal tics because it is explained from your anxiety, because you not prepare a subject and every time ma'am, ma'am, this may be explain your anxiety situations. Так, and finish. Так, we finish this lectures. Please, it is remember mental retardation. I repeat, the mental retardation we observe in the old age. 15, 16 lecture information. It is mental disorders 80 and 80. 90, it is touch only disorders at the children from born to the 15 years, usually, or sometimes to the 18 years. Finish, goodbye.